Hi, I'm Heather. I'm going to be a student nurse assisting with your care today. Can you tell me your name and date of birth?
My name is Grace Kite, and my date of birth is April 29th, 2005.
Perfect, thank you. So I'm going to ask you a couple questions. So I'm going to be doing a head-to-toe assessment, but I'm going to start with a couple questions. So where are you today?
I'm in the emergency room.
All right. And why are you here?
For abdominal pain.
And what is the approximate time of day?
Noon.
All right. And who is the President of the United States?
Joe Biden.
So patient is oriented to person, place, time, and situation. She is appropriate. She appears her stated age. She is well groomed and well nourished and well developed. She is dressed appropriately for the weather. Her behavior is alert, appropriate effect, and the mood for the situation. Her level of consciousness is attentive to focused stimuli, and her speech is clear, coherent, and appropriate rate. She responded appropriately and cooperatively to my questions. So I'm going to get your vitals. I'm going to get your temperature. Thank you. So your temperature is 98.9. Normal range is 96.4 to 99.1 Fahrenheit. I was also able to assess your respiratory rate, which is 20. Normal range is 10 to 20 breaths per minute. Let's get your O2. Just relax. So your oxygen saturation is 99%. Normal range is 95 to 100%. I'm going to get your, check your pulse, your heart rate. So pulses are present bilaterally. So your heart rate is slightly elevated at 106 beats per minute. And I'm going to get your blood pressure. Perfect. And just relax your arm. Sorry. There you go. So your blood pressure is 118 over 89, really great. So 118 over 89, the normal range for blood pressure according to AH guidelines is 90 to 120 systolic over 60 to 80 diastolic. So you mentioned that you had abdominal pain. If you had to rate your pain on a scale from 0 to 10, with 0 being no pain and 10 being the worst, what would you rate it?
9.
Okay, great. And is there anything that you do that you can think of that makes it worse or better?
No.
All right. And do you feel it's more localized or radiates to different parts of your body?
It's just been in my stomach.
Okay. And when did your pain first occur?
It started around this morning.
Okay. And do you have a history of abdominal pain or take any medication for pain?
No.
Okay. And so next I'm going to move into checking your skin. So upon inspection of the patient, her skin is appropriate for race and ethnicity. It is warm, smooth, dry, and intact. Turgor returns to baseline in less than 2 seconds, and her capillary refill returns to baseline in less than 3 seconds. There is no edema. Is there any tenderness around your IV?
No.
Okay. There's no edema around here. The dressing is drying intact. There's no bleeding or discharge. I'm going to check the paint and see. So her line is painting. I'm going to Okay. And we'll have you look straight ahead. Okay, thank you. Perfect, thank you. So her pupils are equal round, reactive to light. Everything is symmetrical on her face, and I'm gonna have you lean your head back and lean your head forward, and then open your mouth, say ah. Mucous membranes are moist and pink and moist. I'm gonna move down and check your pedal pulses. So pedal pulses are 2 plus bilateral. There is no edema, no swelling in her joints. Is there any tenderness?
No.
Okay. All right, I'm gonna push down. Don't let me push down. Perfect. Push down my hand. Perfect. Don't let me push down. Push down. Perfect. Can you wiggle your toes? Her heels or skin integrity is good. There's no incisions or wounds on her extremities or body. So can you wiggle your fingers? Perfect. So lift your arm up. Don't let me push down. Don't let me push down. All right, push against my hand. Don't let me push up. Perfect. Don't let me push up. Perfect. Same thing with your legs. Lift your leg up. Perfect. Don't let me push down. Great. Thank you so much. So her strength is good in all her extremities. So now I'm going to move into checking. First, was there any numbness or tingling?
No.
Okay. And you were able to move your extremities, okay? So there's no paralysis or paresthesia. Already assessed her skin. There's no pallor in her skin as well. We'll move into checking your cardiac. So I'm going to be listening for S1 and S2 sounds. S1 is the closure of the AV valve, and S2 is the closure of the semilunar valve. So I'm going to start over here at your your right intercostal space is your aortic. You would hear S2. Your second right intercostal space, aortic, you would hear S2. Second intercostal space on the left, pulmonic, you would also hear S2. Third intercostal space, Erb's point, you would hear S1 and S2. Fourth intercostal space on the left, you would hear S1. And fifth intercostal space on the left, mitral, you would also hear S1. So your rhythm is normal. Your rate was slightly elevated, which was also present when I checked your pulses. I'm going to listen to your respiratory. So I'm going to listen front. I'm also going to listen back. You're just going to take a deep breath in every time I move my stethoscope, and then a deep breath out, okay? All right, I'm going to have you sit up. Deep breath in. And out. In. And out. Same. And out. One more time. Perfect, thank you. Now I'm going to do the same thing on your back. Deep breath in. And out. Deep breath in. And out. In. And out. And last time. In. And out. Great, thank you. You can lean back. So your rate and rhythm were normal on your breathing. There were no adventitious sounds present. No nasal flaring, no use of accessory muscles to breathe. I didn't recognize any respiratory distress. Have you had any cough?
No.
All right, so and no spit up. You haven't been spit up any. So no cough or sputum. Patient is on room air. And like I said, breathing was normal. Next, I'm going to just listen to your stomach. So I'm going to assist you. Can you lay down? Great, thank you. Is it okay that I touch you in your stomach? All right. I'm going to listen and then I'm going to palpate, okay? So your valve sounds were slightly abnormal. They were hypoactive. I'm going to now palpate. I'm not going to press too hard, but let me know if there's any tenderness in any place I touch, okay?
Right there.
Okay.
Yep, there too.
Okay. So you shouldn't feel any tenderness when I was palpating, so that would be an abnormal finding, okay? I'm going to have you sit up. So how was your appetite this morning?
I didn't have one.
All right, and when would you say your last bowel movement was?
1 to 2 days tops.
All right. And have you peed today? Have you had any urine? Okay. And so on her urine output, I would check for the amount, the color, and the clarity. I'm going to assist you to stand up, and I'm just going to check your range of motion, okay? All right, face forward to me. Perfect. So upon section of the patient, everything, all her extremities are symmetrical. Now I'm going to check your range of motion. So just turn your arm around. Great. Now this arm. Perfect. And then perfect in your leg. Other leg. Wonderful. Thank you. So now I'm going to check your gait. So I'm going to have you turn around. I want you to take a couple steps that way to the dresser and then turn right around and back to me. Wonderful. Perfect. Thank you. So her gait is steady. There was no unbalance or any, did you feel okay walking? You didn't feel anything? Okay. You can sit back down. So to conclude everything, I would lower the bed to the lowest lock position. I would raise the top 3 arm rails of the patient's bed, and I would put the call button within reach.